We are here today to give you up-to-date information on heart disease. To understand heart disease, let's first take a look at the heart. The heart is the organ that pumps blood with its life-giving oxygen and nutrients to all tissues of the body. If the pumping action of the heart becomes inefficient, vital organs like the heart, like the brain and kidneys, suffer, and if the heart stops working altogether, death occurs within minutes. Life itself is completely dependent on the efficient operation of the heart. Now, there are many kinds of heart disease, and they can all affect the heart in several ways. But the ultimate problem with all varieties of heart disease is that in one way or another, they can disrupt the vital pumping action of the heart. Now, bring up heart disease, and most people think of a heart attack. But there are many conditions that can undermine the heart's ability to do its job. In fact, there are more than 50 types of heart disease, including infections, arrhythmia, congenital heart defects, but we'll take a glance at some of the most common. Coronary artery disease, or also known as CAD, is the leading cause of heart attack and is the most common form of heart disease. It is caused by a narrowing or a clogging of the coronary arteries that supply the heart with oxygen and nutrients. Now, CAD can cause angina, also known as chest pain, cardiac sudden death, and also heart attacks. Now, what is a heart attack? A sudden interruption in the blood's heart supply. This happens when there is a blockage in the coronary arteries, the vessels that carry blood through the heart muscle. Now, when the blood flow is blocked, heart muscle can be damaged very quickly and die. Alright, and now heart failure. This develops as a result of weakening of the heart muscle. This is often brought on by other conditions that damage the heart muscle, including atherosclerosis, heart attack, high blood pressure, heart valve problems, and alcohol abuse. Now, heart disease is the leading cause of death in the United States, responsible for approximately 40% of all deaths. It encompasses a broad group of diseases that affect the normal functioning of the heart. The chambers, valves, muscles, and blood vessels of the heart can all be damaged due to heart disease. However, regardless of the structure affected, it ultimately leads to the impaired ability of the heart to pump blood throughout the body. Now, according to the American Heart Association, there are around 5 million people living with the potential of heart failure happening to them. So now that I have your attention, I'm sure you have many questions. Who gets heart disease? Am I at risk? What causes heart disease? How do I prevent heart disease? And what types of treatment are available? I will now turn you over to my colleagues who will give you the answers to those questions.
Who's at risk? Heart disease is hereditary. Heart disease can run in the family. Genetic factors likely play some role in high blood pressure, heart disease, and other vascular conditions. However, it is also likely that people with a family history of heart disease share common environments and risk factors that increase their risk. The risk for heart disease can increase even more when hereditary is combined with unhealthy lifestyle choices, such as smoking cigarettes and eating a poor diet. Know your risk factors. Age. Men older than 45 years of age and women older than 55 years of age or who have gone through menopause are at a greater risk for heart disease. Family history. You can't change your family history, but it is important for you to know what runs in your family. Cholesterol. There are good HDL cholesterol and bad LDL cholesterol types. To reduce and prevent high, which is bad cholesterol, limit how much fat you eat and exercise regularly. Gender. Overall, men have a higher risk of heart attack than women. Stress. Stress is considered contributing risk factors for heart disease because of its effect on the heart are not completely understood. Smoking. Smokers are at a higher risk as well to getting heart disease. Quitting is the single best change you can make for your health. If you live with a smoker, breathing his or her smoke can also affect your health. Diet. A diet high in fats has been linked with heart disease and many other health problems. Fat in the bloodstream can harden and clog your arteries. A healthy diet is high in fiber and low in unhealthy saturated and trans fat. Deaths. Deaths vary by ethnicity. Here are some comparisons of race and risk. Heart disease is the leading cause for people of most ethnicities in the U.S., including African Americans, American Indians or Alaska Natives, Hispanics, and whites. Race of ethnic groups. African Americans are classified with 25.8%. American Indians / Alaska Natives are at 19.8%. Asians and Pacific Islanders are at 24.6%. Hispanics are at 22.7%. Whites are at 27.5%, and all other races are at 27.2%. Americans at risk. The risk factors percentage for inactivity is 39.5%. Obesity is at 33.9%. High blood pressure is at 30.5%. Cigarette smoking at 20.8%. High cholesterol at 15.6%. And diabetes at 10.1%. Although some research suggests that alcohol can help against heart disease, moderation is the key. Limit how much alcohol you drink. This means no more than 1 cup a day for women and 2 cups a day for men.
Risk factors. The risk factors are divided into major and contributing. The major risk factors are high blood pressure, high cholesterol, diabetes, obesity and overweight, smoking, physical inactivity, and gender, hereditary, and age. High blood pressure means that the pressure of the blood running through the arteries is too high. It can vary with age and activity, but a resting healthy adult should have a blood pressure of 120/80. High cholesterol is needed in the body, but when produced in excess by the liver or consumed in foods, it can be detrimental to health. It is deposited into arteries, most importantly those in the heart, which causes the buildup that can lead to heart disease. There is good and bad cholesterol. The good is HDL, or high density lipoprotein, and actually gives protection against heart disease. The bad is LDL, or low density lipoprotein, and when amounts in the body are excessive, it can raise the risk for heart disease. The main culprit of cholesterol comes from saturated fats, and it is specifically the LDL levels that cause the plaque buildup and results in heart attack and heart disease. The next one is diabetes, and the risk is caused by the buildup of sugar in the blood. 65% of people with diabetes are killed by some sort of cardiovascular problem associated with uncontrollable diabetes. You can significantly lower your risk for heart disease by keeping your diabetes under control. When it comes to obesity and being overweight, the excess body fat is linked to higher LDL levels, diabetes, and high blood pressure. A normal BMI is 18.5 to 24.9, and it is the healthiest and best way to prevent heart disease. Smoking promotes atherosclerosis and increases the level of the blood clotting factors. Nicotine raises the blood pressure, and the carbon monoxide reduces the amount of oxygen that the blood carries. It can tighten your major arteries and create irregularities in the timing of the heartbeat. All of these make the heart work harder, ultimately leading to some type of heart disease. Physical inactivity is very important. People who don't exercise are at greater risk of developing some type of heart disease. Mainly, it burns calories, which can help control all of the major risk factors previously mentioned. It can also strengthen the heart muscle, making the arteries more flexible and agile. The contributing risk factors are stress, sex hormones, birth control pills, and alcohol. Stress is contributing because everyone deals with it differently. We do know that stressful situations raise the heart rate and blood pressure, which increases your heart's need for oxygen, making it work harder. During stressful situations, the nervous system also releases excess hormones, causing blood pressure to rise, damaging the lining of the arteries. And when they heal, they can become thicker, making it easier for plaque to build up. Sex hormones are mainly a cause for concern in women during menopause. The changes in hormone levels can affect the heart rate and blood pressure. Next, the risk with birth control pills is targeted at women who are over 35. The changing hormone levels mixed with the pills can dramatically increase the risk of blood clots and heart disease. Finally, alcohol is also a contributing factor due to the fact that it is linked with problems such as increased blood pressure and irregular heartbeats. Moderate drinkers are actually known to have lower risk of heart disease than those who don't drink. It is never too late or too early to improve your health. By eliminating or slowing down on the changeable risk factors, you can dramatically drop your risk for heart disease.
Prevention. There are 6 basic nutrition steps you can take to have a heart-healthy diet. The first and most important step is to lower your blood cholesterol levels by limiting your fat intake. This can lower the buildup of plaque in your arteries, which increases your risk of heart attack and stroke. The AHA has some fat recommendations for your diet. You should have less than 7% of your total daily calories be saturated fat, less than 1% of your total daily calories be trans fat, and less than 300 milligrams a day of cholesterol for healthy adults, less than 200 milligrams a day for adults with high levels of LDL or bad cholesterol, or for those taking cholesterol-lowering medications. A good way to lower your trans fat intake is to limit your solid fats like butter, or by choosing meats with less than 10% fat. You can use monounsaturated fats in their place, such as olive oil or canola oil, as well as polyunsaturated fats like nuts and seeds. The second thing you should do to prevent heart disease is to eat low-fat protein sources, such as poultry, fish, low-fat milk, and egg whites. Fish can also provide you with the omega-3 fatty acids that would help to lower triglycerides. Try to avoid fatty foods like whole milk, hot dogs, bacon, and anything fried. The third step is to eat more fruits and vegetables. These foods are low in calories and high in fiber, and also provide a supplement that helps reduce the chance of cardiovascular disease. You should try to avoid eating frozen or canned vegetables with added sugar, or canned foods with high amounts of sodium. The fourth step in preventing heart disease is to increase the amount of whole grains you eat, such as whole grain bread, whole grain pasta, oatmeal, and cereals high in fiber. Whole grains are good because they provide a lot of fiber and other nutrients that regulate blood pressure and keep the heart healthy. A good way to increase whole grain intake is to eat them in place of refined grains such as white flour, white bread, biscuits, and donuts. Another major step in lowering blood pressure is to lower your sodium levels. Adults should have no more than 2,300 milligrams of salt a day. Most of the salt we eat is already in processed foods such as frozen dinners or canned soups, so a good way of limiting your salt intake is to eat fresh food, cook your own meals, or find food with reduced sodium. Also, a lot of salt comes from what you put on food after, such as salt, ketchup, and soy sauce. So either try not to use as much of these or find reduced sodium alternatives. Controlling your portion size is another way of eating healthy. Knowing what types of food to eat is good, but if you eat too much of them, then the calories will build up and it won't be helping out too much. Try not to get seconds or overfill your plate, and don't eat until you're stuffed because that's just extra calories you're taking in. Be sure to read the packages for correct portion size and use measuring cups to get an accurate amount. Creating daily menus allows you to plan ahead so you know what you will be eating that day. Use these steps to create heart-healthy meals and switch it up every once in a while so you're not eating the same foods every day. A snack every once in a while won't hurt your diet and is a good reward. Just try not to let it get out of hand and only have one every once in a while, not every day. Along with this diet, exercising for 30 minutes a day, most days of the week, not smoking or using tobacco, maintaining a healthy weight, and getting regular health screenings such as blood pressure, cholesterol levels, and diabetes screenings will help keep your chances of heart disease down.
Treatments of heart disease may include lifestyle changes, medications, and medical procedures. For most people, lifestyle changes may be the only treatment needed. Like with prevention, your doctor may recommend the TLC approach. TLC is a 3-part program. The first part is a healthy diet. The TLC diet is recommended, and the recommendations are the same as with prevention, which Brett previously explained. You should also quit smoking and limit alcohol intake. The second part is physical activity. Adults with heart disease can benefit from as little as 60 minutes of moderate intensity aerobic activity per week, and the more active you are, the more you will benefit. The third part is weight management. You are recommended to lose no more than 10% of your original body weight, and you should aim for a BMI less than 25. If lifestyle changes aren't enough, you should take medications. Medications can help to lower your risk of heart attacks or of dying suddenly, and it can also help to prevent or delay the need for a surgery or procedure. Some medications are anticoagulants, aspirin, beta blockers, fish oils, and other supplements high in omega-3 fatty acids. If these changes aren't enough, you should have a surgery or procedure. The most common procedure is angioplasty. It is a non-surgical procedure that opens clogged or blocked arteries. It is done by inserting a thin tube with a balloon into the artery and then inflating it. By inflating the balloon, it allows for more blood flow to the heart. And the most common surgery is coronary bypass. This is done by either grafting a vein from your artery from your leg to the aorta or to the coronary artery. You can also do it by diverting mammary artery to the coronary artery itself. By doing either of these, it can allow blood to flow beyond those blockages.
Well, I hope most of your questions have been answered today. But if you are still concerned, you should go see your primary physician. And also know that heart disease is the #1 killer in America, but it is also the most preventable. So take proper precautions to live a heart-healthy life.